The common state of compliance. If we were to take a brief snapshot of what is commonly found in most companies' approach to QMS, you would find a QMS consisting of multiple, single-point solutions. One application for document management, another for training, and yet another for change control, with no integration or collaboration between them. It is also very common to find a combination of paper-based and partially electronic hybrid systems. Another common attribute to most life science companies' approach to QMS is the use of multiple layers and silos within their organization to manage the individual components of the QMS, resulting from multiple single-point solutions being implemented. You would also see systems with static metrics. Most of the commercially available QMS applications provide metrics around things like the number of deviations, non-compliances, or complaints by week, month, quarter, or however else the user would like to slice and dice the data. And while the data is very useful, they typically do not report metrics relative to the number of production orders in a manufacturing or ERP system, or distribution orders in the supply chain. In addition, it is not uncommon to find solutions which lack the ability to be integrated with other systems. They might manage training records, but they are not integrated with the SOP system. So when SOPs are revised, there are no triggers or notifications to individuals to let them know that the training requires updating. They are not integrated with the manufacturing or ERP system, so that when a packaging technician scans into a primary packaging room, there is no query that checks to ensure that his or her training records are up to date. We would also find an overemphasis on CAPA, although CAPA is a very important component of QMS. For those of you who may be medical device manufacturers, you will quickly recognize that 21 CFR 820 has an entire subsection dedicated to corrective and preventative action. CAPA has received a great deal of regulatory scrutiny across all of the GXP areas, not just the medical devices, because of chronic issues that have been previously identified and often remain uncorrected. Without an effective CAPA system, life sciences companies in effect end up treating the symptom rather than the disease. Another pitfall of many life science companies is a lack of emphasis on automated, harmonized processes as well as on enterprise-wide risk management. To meet the regulatory and business challenges related to quality management systems, many companies have employed Six Sigma successfully since its introduction by Motorola in 1986. The system has helped the life science companies align their business strategies with critical improvement efforts, to have the ability to mobilize teams to attack high-impact projects, accelerate improved business results. Over the last 10 years, however, increasing criticism has been directed towards the Six Sigma approach, with critics arguing that it is less than beneficial for companies to implement for a number of reasons. Namely, it stifles innovation. In fact, 3M ditched the Six Sigma philosophy shortly after adopting it, due to its negative implications regarding the suppression of innovation. It is a program fitted to the organization, not a philosophy that fosters future growth. There are limits to its success, and the substandard bottom line results. It was commonly held that after implementing Six Sigma, a company's stock price would rise and outperform the S&P 500. However, the jury is still out as the results are mixed and unconvincing. A survey of 58 companies using the Six Sigma program revealed that 91% of them underperformed compared to the S&P 500.